Health Info, bringing you well-researched medical information. Is it cold or is it COVID? With the recent COVID pandemic just behind us, and the evolution of new COVID strains, people get anxious even if they sneeze. The first question that comes to mind is this a common cold or is it COVID? In this video, you will learn the difference between a common cold and COVID. This video will also tell you how both can be transmitted, available treatments, and potential complications. So what is the difference between cold and COVID? You may find that some things are common among the common cold and COVID. Both are caused by viruses that infect the respiratory tracts of our bodies. Both spread from one person to another through droplets from mouth or nose. But these are perhaps the only similarities between the two. All common colds are caused by coronaviruses. But these are different from the SARS-CoV-2, which causes the coronaviruses. You would get COVID only if you got infected with the SARS-CoV-2 virus or its mutations. So if both common cold and COVID are caused by the same family of viruses, how does COVID differ? Compared with colds, COVID-19 has a longer potential incubation period, causes more varied symptoms, and has a higher risk of complications and fatality. What are the symptoms of common cold? The common cold can cause a runny or stuffy nose, sneezing, sore throat, reduced sense of smell or taste, cough, and tiredness. COVID may also have the symptoms of common cold, but in addition, patients will experience fever, shortness of breath, dry cough, fatigue, headache, muscle or body aches, new loss of smell or taste, nausea, and diarrhea. It is also important to remember that each person may present different symptoms when they contract COVID. What are the less common symptoms of COVID? Skin rashes, conjunctivitis or pink eye, chills, dizziness, irritability, anxiety or depression, and disruptions in sleep. How soon do patients develop a cold or COVID infection? People with COVID-19 tend to develop symptoms around 5 to 6 days after exposure, although it can take up to 14 days. By comparison, colds typically cause symptoms within a few days. Can common colds cause severe complications? Most of the common cold viruses are self-limiting, and the cold usually goes away after a few days. Usually, a person with cold would not have any severe complications and clear up without any special treatment. But in people who are susceptible, infections of the sinuses or ears may take place. Patients who have poor immunity may develop pneumonia. What are the severe complications of COVID? Patients who catch COVID are at a higher risk of having more complications. Complications of COVID-19 can include acute respiratory distress syndrome, sepsis, thromboembolism, organ damage or failure, and long COVID. How do you cure a cold? There is no cure for the common cold. However, some over-the-counter medications, such as acetaminophen or decongestants, may help relieve the symptoms. Rest and plenty of fluids usually help patients recover. How do you treat COVID? There are some medications available for patients who get infected with COVID. Some measures that help manage COVID include antiviral drugs, such as remdesivir, steroid drugs, such as dexamethasone, monoclonal antibodies, and ventilators to help with breathing. What to do if you experience any symptoms? There are a few recommendations for patients who believe they might have caught a cold or COVID. Patients with symptoms should stay at home and isolate themselves from the rest of the household. Where possible, the patient should use a separate bedroom and bathroom. If the person lives with other people or pets, they should wear a face mask that covers the nose and mouth. Wash the hands regularly with soap for 20 seconds, particularly after coughing, sneezing, using the bathroom, or handling food. Always clean and disinfect any surfaces that people touch often, such as door handles. Continue monitoring symptoms and contact a doctor if they worsen. People with the symptoms of a cold who are unwell for over 10 days, or who are experiencing severe or unusual symptoms, should also seek medical advice. When should a person seek emergency help? A person should seek immediate help if they start experiencing some of these rapidly developing or alarming symptoms. Difficulty breathing, persistent chest pain or pressure, confusion, inability to stay awake, or blue or white lips or face. They should also contact a doctor if any of their symptoms suddenly worsen. Reach out to your physician if you experience worsening of your symptoms in both cold and COVID to catch any complications at the beginning and to treat them effectively. Keep watching our videos to learn more about COVID. If you like our videos and want to learn more, please leave a comment below. Subscribe and share to help others.